Researchers at Duke Health in Durham, North Carolina, have achieved success with the world's first partial heart transplant in an infant, according to a study published in the Journal of the American Medical Association. The innovative procedure, performed in the spring of 2022, involved replacing heart valves in a child using living tissue, enabling the valves and arteries to grow with the patient. Unlike previous methods using non-living valves, this approach eliminates the need for frequent replacements and associated surgical procedures, which had a high mortality rate. The study also showed that the partial heart transplant required only a quarter of the immunosuppressant medication used in a full heart transplant, potentially reducing detrimental side effects. The success of the procedure opens the door to a domino heart transplant concept, where one heart can save 2 lives by donating healthy valves to another patient in need. The researchers hope to bring this innovation to a clinical trial, aiming to significantly impact the availability of hearts for children with heart disease.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.